If anyone wants to know what the effects of public policy are, they only need ask those who deal with the aftermath: social workers, school teachers, and cops. We deal with people after they become statistics in theoretical political debates. I was a police officer for 30 years. I spent most of my career with the Monroe County Sheriff's Office Police Bureau. I was a patrol supervisor and then watch commander for the last 15 years of my service. One of my responsibilities in these ranks was to respond to and investigate any death by causes other than natural causes. This is how I became personally involved in the inadequacies of our current health care insurance system. I responded anytime someone committed suicide while I was on duty. Aside from the issues stemming from a general inattention to the scope of treating the medical conditions that lead to suicide, which I believe are left wanting due in part to the unprofitability of treatment, I want to relate to you several experiences I had that at times still haunt me. The situations I experienced are those that I have not heard addressed in any of the debates regarding the human costs of health care. Those costs are the anguish and suffering of human beings in dire circumstances that they are in through no fault of their own. These experiences dealt directly with the consequences of feelings of economic despair on the part of people suffering from terminal, chronic, or debilitating medical conditions. I witnessed this suffering during investigations that would indicate that a suicide victim had ended his or her life, at least in part because of the economic burden placed on them and their family. To this day, I remember one in particular. A working-class, terminally ill man in Henrietta had sent his wife out on an errand and then shot himself. He left an apologetic letter that they could no longer afford to pay his medical bills without losing their home. His decision was based on the financial ruin of his family as the cost of his illness progressed. In another case, I became familiar with a local man I interacted with as a police officer. He worked for one of the educational institutions in my area, and we had both professional and personal interactions. His struggle with a terminal disease would last over 2 years. The problem is that after the first year, his employer would let him go, and the cost of deductibles and ancillary costs would force him to sell his home and use up his college funds, as he and his wife had worked to save for his 2 daughters. A month before he died, he confided in me that he was consumed by the thought that the longer he lived, the poorer his family was getting. In his last weeks, he was filled with guilt about the financial burden he had placed on his family. The idea that a man's thoughts in his last months of life were centered on how his illness was driving his family broke, when there is an alternative that we know from others' experience works, is simply unacceptable.